Today is episode 161 of the All About Breastfeeding show. Today will be a repeat of one of my favorite episodes. We will be back with fresh shows in season 4 starting April 17th. Enjoy today's show.
Speaking to families, interacting with families, looking at a child in a family perspective is what really gives me the joy in pediatrics.
Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 39. Let's learn about tongue tie together. Hi everyone. I have another two-parter. Episode number 39 is today, and the next show is episode number 40, which I will release on Monday. What a milestone. I remember asking my guest who's on today over 6 months ago to be on this show. Between the time it took me to get started and his schedule and my work and editing schedule, we are finally here. I just know you are going to enjoy this show. If this is your first time here, let me welcome you to All About Breastfeeding, the place where the girls hang out. You should check out my first few shows. Show number 1 is where I tell you my reasons for hosting the show. On other shows you'll find I interview guests about their breastfeeding journey, authors and midwives and physicians who share their personal experiences as well as their knowledge in the birthing and breastfeeding field. There are shows where I just get on the microphone and kind of wing it and talk about some of my personal experience with breastfeeding, or I share stories of moms that I have worked with. No need to worry. I always change the names and dates just enough that the info will never let you know who it is I'm talking about. Your feedback has been great, and it continues to let me know that I am on the right track. I had envisioned a show that provided a forum for mothers to share their breastfeeding journeys. I have been in many moms groups myself, and I facilitated literally hundreds of mothers groups. And the one mainstay that most of us share from our experiences being in a group is how much better we feel when we know we are not alone, when we know that other mothers have gone through challenges too. Motherhood and breastfeeding is not really about good or bad, right or wrong, pass or fail. Every mother loves her baby, will bond with her baby, and will be okay. It is about the support we receive while on this journey that really counts. So thanks so much for your interest, for the time you spend here listening to the show, and for sharing shows with other people. That is wonderful. And you know what? Also for helping to support and advocate for the breastfeeding family. I have some fantastic shows coming up, but I'm going to hold the names of my guests close to my chest. Yes, that pun was intended, just to keep that excitement going. I encourage all of my All About Breastfeeding listeners to go to my website, and there's a link that you can click on and leave me an actual voicemail. You'll see it right there on the right-hand side of the page. Let me know your thoughts about the show, and I'll play your message on air. Feel free to send me any suggestions about future guests or topics. You can send me that in an email. The place for you to head on over to do that is allaboutbreastfeeding.biz. The next request really shows how much I'm loosening up behind the mic. I am going to ask you, my listeners, to do me a favor, as my daddy used to say. I would be so grateful and appreciative if you took the time to go to iTunes and you look up All About Breastfeeding, and then you can subscribe to the show and then take another minute to leave a review. I'm really asking you to do this because iTunes loves when a show gets reviews and they show their appreciation by making the show even more visible. Okay, so as for today's show, episode number 39, I hope you really like it. So remember, today is part 1, and in 4 days, on Monday, I will release part 2. For right now, let's get started. This gentleman, Dr. Rajeev Agarwal, is a local pediatrician who lives in Arizona, has a beautiful wife and 2 children, has a thriving pediatric practice, and is very creative and artistic, and is the mastermind behind his amazing office experience. You will have to go to his website and take a tour of his office, and you will see exactly why I say amazing office experience. Dr. Agarwal has achieved so much since he opened his first office in Phoenix. He moved to Arizona in May of 2005 and opened up his first office in July 2005 with 1 employee and 1 provider. Over the next 4 years, his practice doubles in size, he adds more providers, and opens a second office. Dr. Agarwal receives the first of many awards from Phoenix Magazine as Top Doc and Patient Choice Awards as Most Compassionate Doctor. Up until this point, Dr. Agarwal is certainly cruising along nicely, and by 2012, he is on the fast track. He outgrows his original space, moves to a larger location, hires more staff, and receives several more awards. Dr. Agarwal continues to expand his knowledge on tongue tie and is now seen as an expert in evaluating for ties and for performing a very specific procedure for this, which we will talk more about. Dr. Agarwal has long ago realized the relationship between breastfeeding and tongue tie babies and began to understand that this medical issue has the potential to cause some mothers a great deal of pain when breastfeeding and sometimes makes breastfeeding impossible. Along the way, I believe that you have realized that you have a strong desire for helping breastfeeding mothers, and a passion has been ignited within you, and you spend significant time learning all you can as well as teaching others what you know. Dr. Agarwal, you're a lifetime member of American Breastfeeding Magazine and a member of IATP, which is the International Association of Tongue-Tied Professionals. Dr. Agarwal is in demand as a speaker and has given over 20 workshops speaking about tongue tie to the local as well as the global community. I consider myself incredibly fortunate that you have taken the time to sit down with me and chat about yourself, your love of pediatrics, and your interest and knowledge on the subject of tongue tie and babies and moms. I would like to welcome you, Dr. Agarwal, to All About Breastfeeding. I'm excited to get this interview started. Welcome to the show.
Thank you so much, Lori. I feel honored and privileged to be a part of this initiative that you have taken to educate more mothers and have a bigger reach in the community so that more mothers are able to breastfeed. And I am very privileged to be on this show to discuss my passion, which is to help mothers breastfeed, especially if they're having problems associated with tongue ties.
Great. We are going to get into that. The first thing I want to do is add just a little bit of personal info because it's nice for people to know a little bit about the personal side of my guests. And I think in particular, when you are a physician, sometimes people don't have the opportunity to know a little bit about your background. So I would first really like to start off with you sharing with us a little bit of background about what life was like for you as a little boy in the family that you grew up in.
I was born in India and grew up in different cities because my father used to work for the government and he's a telecommunications engineer and used to get transferred from one city to the other every couple of years. My mother was a homemaker. We are 4 siblings. I'm 3 out of 4. I was very blessed, and I feel still blessed because I really had a charmed life with doting parents and siblings. Growing up in India, it was very interesting that when we got sick, my mom did a lot of home medicine, and we didn't really go to doctors as much as I think we might have gone if we were in any other part of the world. And hence my interest started in medicine at that time, but mostly alternative medicine. So it was The seeds of what my interests would grow in were planted right when I was a child growing up in India. I did my med school in India, and and after that I came to the US.
At what point did you realize that you wanted to become a physician?
This is a very good question, and I'm not even sure of that. I never thought as a child, I was a very easygoing child who was busy in his own world of painting and drawing and doing something creative. All I knew was that I was going to excel at whatever I wanted to do. Because my dad was as an engineer, I started engineering school and but just did not feel the love from it. I did really well in it, and after a year, my sister looked at me and said one day, "You don't look very happy doing what you're doing. You are a very caring person. You should try to be a doctor." And I said, "Okay, I'm going to take the exam." And I took, and I did very well and was accepted in med school. So it really kind of grew up. It was a long drawn process that I ended becoming a doctor. And as a kid growing up, I never thought I would.
That's interesting that your sister saw that in you.
Yes, it was very interesting. We are a very close knit family, and my sister, she was going to med school, and I was a person who really used to care for, everybody around, talking to them, making sure they were doing well. And she said, "You are just so caring. You probably will enjoy medicine more than just all the physics and the math of it." And I'm so glad that she knew me better than I did myself and suggested that I become a doctor because that's probably the biggest benediction that I've had in my life.
At what point do you realize that you want to become a pediatrician? Because when you start medical school, the world is your oyster, so to speak. You have many modalities that you can choose from. At what point did you begin to hone in on pediatrics?
That again is a very interesting question. In med school, I wanted to be a surgeon because I thought that they made the most difference. In fact, I started orthopedic residency in India, did it for 6 months, but then again realized this was not something that really fulfilled me. This was very mechanical. The human interaction that I was looking for was not there. Growing up in India, pediatrics was not a very happy branch. You saw a lot more morbidity and mortality. So when the surgical residency was not really doing all that it needed to do for me, I said, I'm going to consider pediatrics. And now that I like to say, I really didn't choose it, I was led to it.
The other thing I'm curious about is that I've met many pediatricians and I've had conversations with them. And when they get into pediatrics, they know that they're going to be working with newborns, infants, and children. But there's an interesting part of them that doesn't really think too much about the interaction that they will have with adults, the parents. So, did you realize that before you got into pediatrics, or is that something that you realized afterwards that it was really the whole family that you were going to be getting involved in, and that you were going to need to to be compassionate and to be able to speak to other adults, the parents?
Speaking to families, interacting with families, looking at a child in a family perspective is what really gives me the joy in pediatrics. Children, I think, are the easiest part of my job, but taking care of the families as such is the most fulfilling. I cannot take care of children well unless I take care of their families about what their perspective is on disease, how they see themselves, not just as cured, but as healed. I have always thought of being a pediatrician is being a part of that family. I grew up in a family which we did everything together. I was sick, my sister was worried about me, my mom was. It was just if something happened to one person, happened to everybody. And that is so true of all our families. So I never thought that I would only take care of children. I always thought, yes, through a child, I will be able to affect a whole time period of a family's life. In fact, when a baby is born, everything changes for a unit of two people who become three or four or five, as the case may be. And with every pregnancy and every childbirth, a family evolves. And that is, being a part of that is the joy of being a pediatrician for me. So I just absolutely love it.
I'm glad that you're sharing that because I think that, I mean, I already know that because I know you, but I'd like for my audience to get to know you a lot better. And I find that sometimes that is a missing piece in recognizing that it's a whole family unit. And I love your words and what you said about how you feel that when a baby is born, that the family unit is changing. And I love that you embrace the whole family. So thank you for that.
You're welcome, Laurie. This is really the most important part of the practice of pediatrics that I see.
I would like to talk a little bit about well, a little bit more than just a little about your journey about tongue ties. And we know that there's a lot more to tongue tie that could fill up a whole day or a conference easily. What I want to do is start off by talking about your journey about learning about tongue ties. And we're going to really focus in on tongue tie because we know that there are other ties and other issues surrounding it. But what I really want to focus in on is the lingual tongue tie. So, can you tell me a little bit about how you first got involved with babies with tongue tie? And let's just start off first for the listener who might not know. I'd love to know a definition in the most simplest of terms about what tongue tie is and how it affects babies' ability to breastfeed well for the long term.
Tongue tie, simply speaking, is a tongue tie, meaning it is a piece of fibrous tissue which impedes or impairs the normal function and the movement of the tongue. This piece of tissue is between the bottom of the tongue and the floor of the mouth. The tongue is a very mobile muscle and it has certain functions. If those functions are impeded, that is called a tongue tie. Now, having that piece of fibrous tissue is a part of the human condition. All 7 billion or more of us have it. Having that piece of tissue does not make it a tongue tie. That makes it a frenulum, which is a normal part of human anatomy. However, if that piece of tissue starts causing functional impairment, we start calling it ankyloglossia, which means anchoring of the tongue, or tongue tie.
And I frequently tell parents, similar to what you said, that all frenulums are not, we all have frenulums, but they're not all created equally, so to speak. And what we're looking for as lactation consultants and what you're considering is the function of the tongue and the range of motion that frenulum may affect a baby's ability to breastfeed, right?
Absolutely. The tongue has very specific functions and movements like the elevation, the lateralization, the extension. And each of those functions of the movement of the tongue gives rise to a function. And if the movement is impeded, so is the function. If the movement is not impeded enough and the function is not impeded, nothing really needs to happen. Otherwise, we will be doing frenotomy on every single person. And that is not really what we need to do. That is not really the truth.
Taking a little break so I can share this info with you. I am really psyched to be able to share this next piece of news with you. My regular listeners are very familiar at this point with Momentum, the organization that I talk about on each show. You know the one that I say saved my life as a new mother, the organization that helped me find other mothers who were new at this whole mothering thing. They became my people. They helped me navigate that first year of motherhood and continued to mother me as I had more kids and my need for support through their toddler years and kindergarten years and elementary school years just kept being needed. I made lifelong friends and they were so helpful that I am doing all I can to continue to support the organization. I want Momentum to continue to thrive, and I want you, my All About Breastfeeding audience, to experience just some of what Momentum is all about. The ladies of Momentum have agreed to give my listeners a 14-day trial membership so you can see what this mother-centered thing is all about at no cost to you. Just hop on over to allaboutbreastfeeding.biz/podcast. You will see a link from Momentum. It's in blue, and you just click it on and it will bring you to the page for you to sign up for your free trial. Honestly and truly, there's absolutely no cost to you. This is just a great opportunity for you to enjoy the discussion groups and the blogs and webinars and educational pieces that are available for free for you. I will have a link to this in the show notes. And now, back to the show. Can you answer this question for people who are curious? What is it different about a baby that needs to breastfeed, latch on well, maintain the latch, maintain suction at the breast, and transfer milk in what the tongue is doing for that process compared to what happens when a baby is bottle feeding?
The mechanics of feeding on the breast and the bottle are very, very different. In bottle feeding, the baby really doesn't have to do that much because the bottle drops or drips in the milk or the formula or breast milk if it has that right in the middle of the oral cavity, and the baby all has to do is swallow. Not much of a lip function or the tongue function is required to make a bolus of that fluid, and it is just swallowing. As opposed to this, the mechanics of the tongue or the oral cavity and all of it put together is very different on breastfeeding, in which the tongue has to extend, which is to come out of the mouth, hold on to mom's nipple, then elevate it so that the nipple is held between the baby's tongue and the hard palate, and then also through a peristaltic movement push that nipple right into against the soft palate or close to the pharynx. So it's a much deeper latch. The nipple is almost like swallowed in by the tongue movements. Hence, the baby's lips and the gums are on the areas of the areola where the glands are, where the milk is stored. And then the baby kind of actively sucks the milk in from that area and puts it right close to the pharynx. This is an active motion of sucking. Hence, there's not that much of a suck required for bottle feeding, but there's a lot of suck and active movement of the tongue involved in breastfeeding.
And the tongue needs to not only come forward and milk the breast, but it needs to be able to do that in a nutritive sucking fashion, in a rhythm and repeatedly. So this gets a little confusing when people are told, well, your baby can stick their tongue out, therefore it does not interfere with breastfeeding. And so it's the repetitive motion, that the function that we need for the tongue to be doing, not just the fact that a baby can stick its tongue out, right?
Absolutely. In fact, I have seen a lot of cases, and I see them every day, in which the extension of the tongue, which is the tongue coming out, is pretty good. But there are other movements of the tongue, the repetitive movement of what you just said. And the most importantly, what I would say is the elevation of the tongue so that the nipple is held between the tongue and the hard palate, which is the most important thing and the most limited in a child with tongue tie. The repetitive motion that we are talking about is also does not happen well if the child is tongue tied, and hence they're not able to do the nutritive sucking as well. The extension is only to get the nipple into the mouth. After that, it's the peristaltic movement and the elevation of the tongue.
And the frenulums that get in the way of productive breastfeeding, it may be that they can do that work for the first couple of minutes, but then the tongue gets fatigued from the supreme effort of needing to extend and elevate and milk the breast, right? So we have a lot of babies who might start off for the first few minutes, and if their mom's breasts are full, they appear to be doing well. But after the first few minutes or the first letdown, that's when some babies begin to falter. So it's a little bit tricky for people, right?
Absolutely. What happens is early on, because the letdown, it really almost, not exactly, but almost works like a bottle in which the babies just have to swallow because what I tell parents is mom's breasts literally see the baby's mouth and dump the milk in. Baby gets a letdown, doesn't have to suck as hard, just swallow. But after that, it becomes an act of active sucking. Then the tongue is trying hard, very, very hard to elevate itself, to get those motions to extract the milk. Feeding is the most important biological function of an infant because that makes it grow, that makes it give, that's the most important biological function. And tongue being the most important determinant of breastfeeding, all the energy that a baby has can be spent in trying to extract that milk. If the mechanics are not in the best shape, the effort can be immense for the baby to try to get that milk from the breast because that is a biological need. And the babies will get really tired. The babies will kind of either lose interest, go to sleep, or just be on the breast all day long because they need to get that milk, which they're not able to do with the mechanics of their tongue, with the relative tongue movement and the palate that they have.
So they're just hanging out there. And a lot of moms will say, well, my baby's there for 25 minutes on each side. And they're thinking that the amount of time that their baby is spending at the breast has to do with the quality of the feeding and the volume that the babies are getting out. But just as you're explaining in simple but detailed terms, it's the activity of what they're doing at their breast that really counts, not the time that they spend there, right?
Lori, this is a very commonly asked question, and I'm so glad you brought this up. The gold standard for adequacy of breastfeeding is not the time spent on the breast. It is weight gain. I have a lot of mothers who come to me and say, my baby must be doing well because he eats every hour. We take the baby's weight. Lo and behold, baby has lost weight since the last couple of days. And mom's like, I don't believe it. The baby's been eating the whole time. Well, that is not the point. In fact, that tells me the baby is trying to eat, spending so many more calories in trying to get that milk out. And that is a sign to me that something needs to happen. I need to look closer to see if there's a tongue tie, if there is something that needs to change. On the other hand, there are moms who come to me, bring their children to me and say, I don't believe it. My kid feeds for 10 minutes, 6, 7 times a day. This cannot be, obviously not be enough. And I take the baby's weight. The weight is at the 90th percentile. This baby is a butterball. And mom is all worried the baby is not gaining weight. Oh, sorry, the baby is not feeding well. Hence, I think one of the very important things that I like lactation consultants to do is milk transfer. If I get from a note that I get from a lactation consultant says that the milk transfer is not adequate, that tells me for the amount of time that the baby is in the breast or of the amount of effort they're spending in trying to get that milk, they did not even cover the calories that they would have gotten from the milk. So that is a very important thing that you just brought up, and thank you for doing that.
All right. So what I would love to do is have you tell us what some of the most common breastfeeding challenges that you observe mothers having with babies who are tongue-tied and struggling with breastfeeding. What is it that you observe, and what are the stories that mothers are telling you that lead you to think maybe this baby is tongue-tied?
The diagnosis of tongue tie is basically dependent on maternal history and the child's exam. So when I see a mom who gives me a very classical history, I look very carefully in the child's mouth. The presentation to me the most common symptom I would say is nipple pain. that can be mild in some cases, and or that can be excruciating in some other cases. I've heard of moms saying that it's like daggers going through their breast and somebody turning the dagger in a clockwise direction. It hurts that bad. That is just the limit of the human endurance of pain almost. I see very commonly bleeding nipples, cracking nipples. I often talk to moms and they have been treated for mastitis at least a couple of times. They know that the baby has a shallow latch because the baby nibbles or kind of gums just the nipple. On the other hand, the baby could be extremely gassy and fussy, failure to thrive. I see babies who are 7 weeks, 8 weeks, and maybe just about at their birth weight. That's a very serious sign of there's something needs to change right there. We see babies who have been diagnosed with colic. Well, guess what? This really is not colic. The baby has been hungry and this is a distress cry saying, Mama, I need more nutrition. I'm trying so hard to get that milk from the breast and it's not working out. I see long feedings at the breast. There are moms who will come and tell me, my baby is at the breast literally 24/7. I'm not sleeping. One of the most important things that I see in this breastfeeding relationship, and I focus a lot on that, is the sense of utter failure that mothers have to go through. This to me, Lori, is a very painful thing because mothers who are trying so very hard feel like they're not good enough mothers, they're not doing enough for their babies. This is very hard. I see sleep deprivation, I see severe, significant postpartum depression, all associated with their feeling of inadequacy because they were not able to breastfeed or they feel like there is something wrong with them. If you work with mothers, you always know that they will think it's something wrong with them and not the whole process of breastfeeding or something mechanical like a tongue tie in the baby. They always take it personally because they give so much. This is probably the most important sign that I see in mothers who present to me in my office.
And you're absolutely right. And it's because as mothers, this is our job.
Yes.
This is our job to make sure that our babies are well taken care of, which means well fed and thriving and gaining well. And also for them to be, by and large, happy and content babies. And when we're living with a baby that can't sleep well, that distress cry, which you and I know, that there definitely is a diagnosis of colic, but also there is labels given to moms and babies, postpartum depression and colic and high needs babies that can really just be all geared towards you take a look at it and you see this baby is tongue tied. And this is what's causing all of these other labels that you've had, all of these other high emotional feelings that you've had. And when you fix the tongue tie, things start to fall back into a place where they should be. And it's just very confusing for them because we just don't know. And I'm certainly not saying that babies who have other health issues are all tongue tied, but frequently I often say that there needs to be a medical diagnosis for sleep deprivation because mothers, when you give birth, I mean, you're tired, you're feeding your baby very frequently and you are very tired, but it takes it to a different level when your baby is not well fed and when they're letting you know that they're not well fed. And we also know the danger is and the risks are there are some babies that stop letting you know that they're not well fed, and that scares us in another way. But it all can be very depressing for a mother because by and large, we take it to heart that we're not doing a good job. So I appreciate that you recognize that it's breastfeeding, but how it also impacts the mother on an emotional level and the whole family and how it can really upset the apple cart in the newborn family.
And that is so true. Of course, as a pediatrician, when I evaluate the situation, tongue tie is one of the things that I look at. There can be a lot of other issues which may be affecting breastfeeding or the family dynamics. However, I think, especially in my practice, where I get a lot of referrals from, local referrals and referrals from out of the city and state, this is one of the very common things which is missed. So when I speak at my conferences and when I teach the pediatricians, um, my emphasis is on include tongue ties in the differential of colic, of failure to thrive, of mastitis in mothers, and things like that, in which most people don't think about. I am no way saying that every child who has colic, every child who has any other issues that I talked about, definitely has a tongue tie. However, what I'm saying is that needs to be a part of the diagnosis and needs to be considered as such and treated if that is found out. I have had quite a few babies who were referred to me by lactation consultants who have had at least a couple of admissions to children's hospitals for failure to thrive, but nobody checked the mouth. Once a tongue tie was discovered, it was taken care of. Somehow magically, these babies started gaining weight. It can be as simple as that, but most often there are a lot of other issues associated with it. Hence, we as caregivers need to keep this as a part of the differential diagnosis, do the needful, and of course, there's no substitute for a good history and a good physical examination to make sure there is nothing else going on. Also, remember, this is a spectrum, this is a whole universe of the breastfeeding mother, in which they depend on pediatric caregivers, lactation consultants, or their family, in which they say, this is the issue that I'm having, please help me.
And you're so right about that. And as an IBCLC, I often tell the mothers that I'm taking a look at the whole picture. And in doing so, I'm going to be asking them a lot of questions. Because if I forget to do that, once I start asking mom question after question, sometimes I feel like she's getting the third degree by me. So I usually preface it by saying there's a lot that needs to be discovered. So I'm going to be asking you a lot of questions, and it's not to judge you at how well of a job you're doing, but it helps me in understanding. So while I know that certainly some babies are tongue tied, I also know that some babies, mom has a lot of milk and she's been keeping the baby at the breast and there's no tongue tie, palate, there's no other issues except for the simple fact that position and latch was way off, and the baby just wasn't being brought to a place where he or she could access the milk ducts, and be able to transfer milk. And sometimes it's just as simple as that. So just like you, I take a look at the whole picture and I check for milk transfer, ask lots of questions about mom's medical history as it relates to lactation. So we're covering everything. What I'd like for you to do is take us through, again, in simple terms, so we can understand what are some of the things that your staff does to evaluate a baby for tongue tie.
So, Lori, we have a tongue tie group of people who work with children and families of tongue ties. It's almost like a project in our office at this time. We in our office have nurse practitioners, physicians, and we have a tongue tie coordinator who make sure that families get in. The first thing we do is try to get the families in with us as soon as we can. Most of our mothers are able to get in within a day, maybe two, maybe three, if at most, for a tongue tie consult. We take referrals from pediatricians, from families, from lactation consultants, from all kinds of places in the breastfeeding world. So when the consult is made, they usually see one of our nurse practitioners who are very well versed in the diagnosis of tongue tie. As I first said, the history is of paramount importance. Unless we get a history of what seems like there is an issue with breastfeeding and what else is going on, it's almost impossible for me to make a diagnosis of tongue tie, and even more difficult to suggest sternotomy. So first part of the whole thing is get a history. Of course, an examination which supports it. That is very, very important. An examination has to support it. Another third thing, which I like to do personally, is get an evaluation from a lactation consultant. Remember, we make this diagnosis on the basis of functional impairment. If I'm seeing a baby with a breastfeeding problem, and as Lori, you said earlier, a lot of times all they need is a relatching. All they need is a better hold. Hence, the function can improve right from there, and I may not have to consider or treat a tongue tie. So I do like to get a lactation consult in. I put all those together, and then we reach up to a diagnosis of tongue tie. It is very useful for us to get a milk transfer from the lactation consultant visit, if possible at all, because then that tells us the milk transfer is at this level, and once we do the procedure, if it goes up or not. So have we made a difference or not? Our staff evaluates the history, the physical examination, the lactation consultant notes. If we think there's a possibility of a tongue tie, then they're scheduled for a tongue tie procedure. Then I meet them and I go over almost exactly the same path again. We discuss the procedure, we discuss the possible risk and complications. And of course, it's done the first time also, but at that time, the parents can make a decision whether they want to get a procedure done or they want to wait and see how things are going.
What I'm hearing you say is that your baby is not coming into your office and being evaluated and having the procedure on the same day. You like to have a lot of education, time for the parents to ask questions. If everybody decides to go ahead with the procedure, then another day is scheduled, and then the parents meet and spend time with you where you ask more questions, you check the baby out yourself, and then the procedure is done. So, what I would like for you to tell us is we're talking about tongue tie, we're talking about the procedure. What I'd like for you to do, again, in simple terms, is tell us what the name of the procedure is and if it's done inpatient, outpatient, how long it takes, if the baby gets any anesthesia. So, kind of walk us through
Sure,
that.
sure. Lori, I'm going to go back to your previous question one more time. The reason we do a consult first is very often the parents are very confused. They've done their Google research, they've talked to their own pediatrician, they've talked to a lactation consultant, or they have not done any of this and they're just worried because the mom's hurting. I think it at a point that they really have to reach is they need to be first comfortable with the diagnosis, and then they need to start thinking about the procedure. Remember, this is a family who's just had a baby. They're already hurting from the breastfeeding is not going on well and all the emotional trauma that we talked about. There's sleep deprivation. There's a lot going on at that time. So the first point is to first enable them, empower them to understand, give them the information. Information is power. Information, knowledge is power. They need to first understand. Then they have to kind of put their thoughts together, come up with questions, ask more questions. Come to a point they say, okay, well, this is a procedure, these are risks and the benefits, and I want to go ahead with it or not go ahead with it. Then they meet me, the person who's going to do the procedure, and get a chance to ask the same questions again. So in this whole process, the focus that we have is family-centered care, in which the mom, the dad, the grandma, everybody gets their questions answered and feels like they are on the same page with us. The success of the procedure really lies with the family, with how they understand the situation, what they're going to be able to do with exercises. I think we're going to talk about it later. Hence, the education part, the support part, seeing an IBCLC is a very important things. These are the important things that we stress on before we come to the procedure. So now coming back to your question, what is the procedure called? People call it frenotomy, frenectomy, frenulectomy. All of those are really coming back to the same old thing. There is a lingual frenulum, which is basically cut at the bottom of the tongue so that the tongue is able to move better. There is really a difference in the use of these, except for insurance purposes, in which they want to say whether the lingual frenulum was sized or it was incised. And that really is a matter of detail. The procedure itself remains the same. This procedure is a very simple procedure, which is definitely done in my office, does not need general anesthesia. I've done this procedure from babies on to adolescents, and I've had really good success with only use of local anesthesia. Babies are able to breastfeed right after the procedure. It's a very short procedure, maybe takes about 5 to 10 minutes. How we do it is first we go over the history in the appointment again. We go over the consent, we go over the risks and the benefits. Then we take the baby to our procedure room, put the baby either on a pappus board, we give local anesthesia at the site, and cauterize the piece of tissue. This is really very simple. It takes about 5 to 10 minutes. In the meantime, our tongue tie coordinator goes and talks to the parents and talks to them about the post op as to what to expect. Most commonly, there's no complications, and we just bring the baby back to mom's. And the majority of the babies are able to go to the breast right away.
This is a good opportunity for you to talk a little bit about, I love all of your staff, but there's one of my faves, which is Valerie. So you mentioned that while you are doing the procedure, that it can be very anxiety provoking for new parents. And I know that Valerie spends time talking to them about what will happen, preparing them for the aftercare and educating them. So, can you just tell us a couple of words about Valerie and the role that she plays with parents?
Well, I can't really say enough about what Valerie has contributed to the tongue tie program that we have going here. She takes the intake calls, she schedules the patients. From the time she takes the intake calls to next 2 or 3 months, she remains available to the mothers through email, through telephone calls, through Facebook, believe it or not. She's a mother herself. She has been my MA for a long time, and she's helped me with innumerable procedures. She and I share this common goal and common passion for seeing success of breastfeeding through this procedure. So, a couple of years back, she said, Dr. A, we need to have a program. I said, Valerie, you go with it. And she has. She is a very good resource. She's not an IBCLC, and she does not give any lactation associated advice, which the parents should seek an IBCLC's help. However, with the post-op, with the information regarding the procedure, to connect people with other professionals in the community, to connect people with other mothers who have been through this procedure, because it really does take a village. And the way some mothers can reach out to other mothers is very, very, very helpful. She coordinates all that. She has a way about herself in which and a lot of parents have told me, decreases anxiety. She comes and she just, she gives you a hug and she just goes about telling you, with sharing experience from other people, and to know that it's very valuable for the mothers to know that there is a person who is available, who's knowledgeable, and who will be there for them is very powerful. Valerie has, I feel really indebted to her, and a lot of mothers in our community do, that she has made it into from just doing the procedure, she has made it into a program in which we are able to offer continued help till the mothers need it.
And while I'm very used to all of this also, I have to tell you that there are, from time to time, she plays a major role in reducing my anxiety, because there are times when I refer a baby to you that really needs to get in as soon as possible, has had major weight loss. And I really feel so comfortable and confident knowing that once they go into your office, that, like you said, it takes a village, and that we will all together be able to help a mother. Because I frequently tell Valerie, what I really love about her is that she stays in her own lane. So if she's recognizing that it's different than a medical issue or response that the parents need, she then tells them, you really need to go back to your lactation consultant, because this is a breastfeeding part of the whole issue. Or she will say, this is a medical related and I can respond to you and help you with that. So I really appreciate care providers who, like I say, stay in their own lane, because I think that's how we do best by mothers, but also working together. So she has received some phone calls from me where I'm a little stressed out, wanting to make sure that this baby gets the best of care. And I know that they will when I send them to your office. And in particular, when I have an opportunity to talk to Valerie about this mom and baby first.
Dory, she decreases my anxiety on days when I'm kind of flipping out. Brought a very good concept about sticking to your own lane. And that is one thing that I really appreciate about Valerie is she does not step on any toes. Whenever she thinks there's any medical, and she has had a lot of experience, she's been a medical assistant for a long, long time. She will bring any medical issues to my attention, and she freely communicates with IBCLCs and chiropractors and anybody and everybody who is part of this conglomerate that we have in our community who want to help our mothers succeed in breastfeeding. She plays a vital role in the services that we provide here at AAB Pediatrics.
And I'm glad you recognize her value and worth there. She's terrific. Thanks everyone for listening to today's show, episode number 39. I'm so glad that you liked it, and I really want you to listen to episode number 40, part 2, which is the next show being released. I hope you enjoy it. Thanks for hanging out with me, and I hope you're enjoying the shows. iTunes makes it so easy for you to get all the previous and upcoming shows. Just go to iTunes and search for All About Breastfeeding and subscribe to the show. As promised, I am now offering several ways that we can connect with each other. I talk to mothers all the time after they have given birth. Many have said they would have liked the opportunity to talk with me before their baby was born so they could go over certain things that may have been troubling them about breastfeeding. You have many questions about your own health, medication you're taking, and how it might impact breastfeeding, or perhaps about your breast and nipple anatomy. Perhaps you have fears or anxieties about breastfeeding, and you feel it will be helpful to talk it out before your baby's born. Some mothers just have a bunch of questions that could not be answered in your regular breastfeeding class because of time or privacy. These are just some of the many reasons you will want to have a Skype consult with me. Talking things through can help you clear the way emotionally for an excellent start with breastfeeding. All you need to do is go to allaboutbreastfeeding.biz/Skype to schedule your online prenatal consult. Next up to talk about, I finally have all the pieces in place and our online breastfeeding mothers group is ready to go. I know how hard it can be in the last trimester just waiting to give birth, looking forward to holding your baby in your arms for the first time, and the excitement building as you look forward to breastfeeding your baby. How great would it be for you to hang out with other pregnant moms and new mothers? Pregnant moms get to find out what new motherhood is like and what newborn breastfeeding is like from brand new moms. And the brand new moms get to talk about all your breastfeeding stuff and ask all your questions about normal newborn breastfeeding. What I have is a virtual online breastfeeding mothers group where you sign on once a week to meet and chat with other mothers who are going through similar experiences as you are. You become friends and support each other. I will be facilitating the group, so you know there's always an experienced lactation consultant ready to jump in and answer your questions and make sure the information is accurate. If you would like to be part of 10 mothers who will meet once a week virtually for 8 weeks to talk about all about your breastfeeding stuff, just check out allaboutbreastfeeding.biz/support. You will find out more detailed information on the group's start dates and prices and how it all works. I really am excited and I look forward to meeting with you on Google Hangout and getting to know each other.